Greetings, this is the coronavirus COVID-19 update for 3/2/2020. And as usual, we'll start with the Baidu numbers. Baidu is a Chinese search engine, and they have a site set up for all of the Chinese numbers. So right now we're looking at cumulative diagnosis at 80,302, up 128 from yesterday. That's a pretty low up number from yesterday when you take a look at what's happening in the rest of the world. Suspected cases up 129. Cures, which is really recoveries, 47,260. And existing severe cases, 6,806. Those are ICU cases where patients are in pretty bad shape. And deaths in China is at 2,947. If you scroll down on the same page, you see this map, which hasn't changed much. It might be projected to change. We'll take a look at that. And then as you scroll down further, you see two graphs. This is the first one, and they plot new deaths, added cures or recoveries, added suspected case and new diagnosis all on the same page. You can see these numbers go up and down daily. But there's a trend. The number of deaths is kind of trending down. The number of new cases is trending down. The number of suspected cases is trending down, and naturally the recoveries are trending up. And then we have the non-Hubei provinces compared to Hubei and then to all of China. And Hubei is in the pink, and it basically follows the red now. Hubei is the epicenter of this thing, and there's not much going on in the rest of the country. Then I don't usually put these three together, but I opened up Hubei province and took a look at Wuhan. So Wuhan was 565 new cases a couple days ago, 193 yesterday, and 111 new cases today, which is really getting down there. China's getting things under control. It's what happens when you spray down the city with disinfectant and nobody's allowed to leave their apartment or their condo, their homes. And if you scroll down further, you see search topics for today. Now these are actually search terms used to look for stories. So we'll take a look at these. These are, the hottest thing to search for, and the number one thing is always the numbers we just looked at. Everybody in China wants to know, what are the numbers today? So one of the stories is an academic who did some modeling and came up with what might happen in China. And they said there might be a second outbreak in mid-March. And the model predictions show that at the end of April, there will be 90,000 to 120,000 in China. That's a lot more than there are today, which is at 80,000, but that's leveling off. And if you see the right, there's a couple other red areas in the map, and I can't tell what that is. That looks like Shanghai in Guangdong province in the south. Expected new cases there. And then some other stories. These are these are volunteers helping out in a hospital, which is nice. And I'm going to make a separate video on masks because I keep seeing the same mistakes. And then the WHO gives 10 recommendations for epidemic prevention. We went over those yesterday in the non-Chinese news. Then I always take a look at the coronavirus COVID-19 by Johns Hopkins at the Center for Systems Science and Engineering. So the first thing I do when I look at this number is see how far behind we are. If you look on the bottom left, this was last updated at 3/2 at 10:03 p.m. And we show 80,151 cases in mainland China, where China is showing 80,302. So we're 150 off there. That would actually put us at 91,000 total. But Johns Hopkins this is a global tracker, includes China and the rest of the world. And there's a map, and I reduced the size of the map to show the United States and North America relative to other areas. You can see there's some big circles. Iran would be one, and Italy would be one, and then there's a big blob, where China is. So we're going to take a look at these and see what's going on. So the three hot spots are, there's three hot spots, and then there's the WHO who arrived in Iran today. And this is the second day in a row where they said that they are most concerned about South Korea, Italy, Iran, and Japan. Now, I don't know why they're concerned about Japan. I can't really figure that one out. I mean, Japan had a pretty big mishandling of the cruise ship, but I don't know whether they have that many cases spreading outside. They were at 256 yesterday. They're at 274 today. It kind of looks like they have things under control, so I don't know what the concern is. But there's a lot of concern about South Korea, Italy, and Iran. So if you take a look at the first one, South Korea went from 3,736 cases to 4,812. That's a pretty massive increase. And then Italy went from 1,694 to 2,036. Also a healthy increase. And Iran, the same thing there. Iran goes from 978 to 1,501. And if you look on the right, the number of deaths, Iran, Italy, and South Korea, 66, 52, and 28, are the largest number of deaths outside of Hubei, China. So that includes all of the rest of China and, other countries. So that's pretty alarming. Okay, so we'll see what the news stories are behind these numbers, starting with South Korea here. So South Korea COVID numbers soar past 4,000. And here's a picture. This is the South Korean army, decked out in protective gear and spraying things down. I have no idea why those sprayers are being held so high, unless it was just for the picture. But maybe in some hot spots in the world, we ought to start following suit. This is what China did. China has published videos from inside of Wuhan with trucks riding by, spraying massive quantities of disinfectant all over the city. So we don't know how effective it is, but it's not a bad idea to do that in the hot spots. And maybe it's time to get the U.S. Army or the National Guard involved in spraying down some hot spots in the United States. And then we have the leader of that church. Now, everything in South Korea, in past videos, we went over this in detail. But this is a South Korean church, a Christian church, a Christian sect that has over 1,000 different churches in South Korea and 450,000 members. And this is the leader of the church trying to apologize. Most news agencies publish this as an apology, and these idiots here said gold watch overshadows the apology. Well, he apologized anyway. So that's the leader of the church trying to get in the better favor of the South Korean people, because he probably doesn't want to see his church disintegrate. This is another one that, it's a religious sect where usually in these sects the leader thinks they're, a new god. And also, what was really interesting today, popped up from South Korea, is these apps. And this is pretty interesting. Take a look at these Korean apps helping people avoid areas. So there's one called, Corona Map. Is that the name of the app? Corona Map? Just a little C with I don't know, a virus-looking thing, I guess, in the background. But this shows you where all the cases are in South Korea, and that's a pretty good app to have. And this app, if a person is using a person using the app comes within 100 meters of a place where a person, has been, then they get a warning on their smartphone. So that's pretty handy to have. Maybe that would help in areas of California and Washington State and maybe Toronto. And there's another app that's similar on the upper right. This one is the Corona 100M. Was launched on February 11th, downloaded over 1 million times. So these are two apps that'll tell you, where to stay, what areas to stay away from. So it's a pretty good idea, pretty good tool to use. Maybe even better than confining people to their homes. It's just, hey, here's a place to not go. Just avoid this place in your travels. If everybody did that, that'd be good. But unfortunately, you can't tell if everybody is avoiding those places, and then that makes new hot areas. It is best to stay inside if you're in a real hot zone, just to be quarantined, self-quarantined. Then we want to take a look at Italy. So Italy is still struggling with this, and Italy doesn't really know where or how coronavirus came into the country, which is unfortunate, which means they couldn't track anybody in the first few days. And, now they're up into the thousands. They've got 2,000 people. So it tells in here what the death toll. Italy jumped to 52 on Monday. And what else is, Italy's tourism board published this little thing. Hey, Italy is a safe place. It's a safe country. It kind of is, except for up north in the red zone, and the red zone is blocked off. There's roadblocks not letting people in or out, and that's where most of the virus is. But there are people infected in other areas of the country, just not too many. Then we go to Iran next, and the numbers here getting up there pretty high every day. Now, nobody knows who started this infection in Iran, but it was due to people, following a pilgrimage and coming back to a particular city in Iran. And, the Minister of Health came down with coronavirus like maybe 4 or 5 days ago. He was shown, beside another person that was making a speech to a big group of people, and he's wiping his forehead with his handkerchief. And he was sick then, and the next day he made another statement saying he's infected with coronavirus. Then we have another woman that came down with coronavirus. She's the highest ranking woman in Iran, and then now we have advisor to the Iranian supreme leader dies of coronavirus. So Iran doesn't have things under control. Like they might think. They announced that they would peak, yesterday. They announced the day before yesterday that yesterday would be the peak, and here they are going up another 600 cases today. So things are not under control in Iran yet. That's why the WHO is there. There's more cases in South Korea, but South Korea is taking measures, and Iran, that's why the WHO went there, just to, check on the measures that they're undertaking and see what they're doing. They did spray down that religious site after everything was all over with, but that the initial spread came from the fact that a lot of these people on this religious pilgrimage, they were staying in the same hotel. It wasn't really a hotel, it was like a hostel where they're just sharing bunks and sharing the same bathroom and eating together, and all confined in a couple of hostels, or many hostels. But talk about a good breeding ground for a virus. That's why Iran is in that trouble now. Then we have 3 other countries that are not considered the hot spots. I didn't do anything with Japan because there's really no news from Japan today. Oh, and incidentally, before I move on, Japan and Others is related because Others was the cruise ship. Now, they announced a couple days ago that all the passengers and all the crew are off at a cruise ship. So why do we still see 705 under Others? Which really was that, Diamond Princess cruise ship. So all of the passengers have been taken off the ship. All of the crew have been taken off the ship. The only thing we don't know is what happened to the crew from Indonesia, because Indonesia wasn't ready to take their people back. So they must be in confinement somewhere in Japan. Who knows? There's no news on that. But most of the crew on that ship was Filipino. They were taken back to the Philippines on Sunday to the old American Air Force Base, and they're in quarantine there. And also there were some people from India who were also part of the crew. So basically 3 countries made up the crew: Indonesia, India, and the Philippines. And the Philippines was 445. That's like half of the crew. Okay, so on to France. France went from 130 to 191, which is a pretty healthy increase. And they're, same deal with this. I mean, France, some of these infections, were around for a long time. Maybe people from Wuhan visiting France, before Wuhan was effectively locked down. And also people coming back from Italy. So that's where France is sitting right now. So the Louvre remains closed. A couple days ago, the president announced that large gatherings of more than 5,000 will be stopped. But that is really big. It should be more like gatherings of more than 500, but it's 5,000. So not much news coming out of France. One thing they mentioned here that was in the French news, which is, the first paragraph there highlighted on the right, China has imposed draconian quarantines and travel restrictions to keep large swaths of the population indoors for weeks, a strategy that appears to have paid off because the number of new cases, I think the number of new cases outside of China now is like 9 times as many as inside of China. So China, really they were late in doing anything, but they've really got things under control now. It appears that way from the numbers. So next is Spain. Spain went from 84 to 120. And Spain claimed a couple days ago that almost all of their cases came from Italy. So that's how they got. That's a ways apart from Spain to Italy, but that's what they say. And it's, it really started popping up after Italy was well into their issue, after that hotspot was well developed. So one thing, Spain's considering closing schools and banning large gatherings, but they haven't done that yet. They're just taking a look at it. Spain reached another 119 confirmed cases by Monday. We have them at 120 now. And what the article on the right is about the U.S. State Department. So the State Department hasn't slapped any travel advisories on for Spain yet, and the CDC has not yet either. But that could be coming because the numbers are getting up there. And then the U.S. went from 76 cases yesterday to 102 today. That's a pretty good size increase. And these are community illnesses where people are just getting sick without any travel history or coming into contact with people who have a travel history to some hotspots. So that's concerning. Just a week ago, the U.S. was at 14, or a little over a week ago. Then the 15th case was in Texas. The 16th was back in California. Then it went from 16 to 60 in one day when we repatriated 45 cases from the Diamond Princess cruise ship in Japan, where nearly all the, everybody on the ship got infected. And then we went from 60 to 70 in one day, from 70 to 76, and now from 76 to 102. So that's pretty alarming. So right now, for all that and overnight, 4 people in the Seattle area have died overnight, and that brings the total number of deaths to 6 in the country. and all 6 of those are in the Seattle area. So the state now has a total of 18 cases, but 14 are in the King County, so 14 is the highest number in North America, tied with Toronto, which also has 14 cases. But I don't think Toronto's has gone up in the last couple of days. So these people, all of these 6 people died at the same hospital. So they're really close in geography together. They were all at the same hospital, and I don't, you got to wonder how that happened. How they got to the hospital so late that they were in terrible condition and we couldn't save them. So, and that has a lot to do with testing. And the CDC, after the first American death, the CDC changed the criteria for a test and relaxed that a little bit. The first lady who died was in really, really bad shape in the hospital, and her doctor insisted on a test for coronavirus, for COVID-19. However, the hospital or somebody told them, or CDC told them, that she doesn't meet the criteria to have a test done. So, she's on a respirator in really bad shape, and she died overnight. And, the hospital was really kind of pissed off at the CDC. So the CDC came out and changed a few things and said, okay, we're going to change the criteria, because the United States had only tested 1,000 people altogether since this outbreak started. And there's some countries like South Korea that are testing 1,000 people a day. And the United States is just really laxed about that. So that changed. Unfortunately, it took the death of somebody, and now we've got 5 other deaths because, the testing wasn't done in time. These people were in a hospital on a respirator in bad condition, and they had coronavirus. And nobody knew about it until they were in really, really bad shape. So of all those people, 2 were in their 80s, 1 in the 70s, a 4th patient was a man in his 40s. So those are the 4 that died overnight. So that's not good. And let's see, what else do we have? Arizona is monitoring 250 people. New Hampshire has its first case. And that's about all the news coming out of the U.S. today. Then the last thing we do every day is take a look at this graph, which is on the Johns Hopkins. On the lower right, you can click a little icon in the upper right corner of the graph to enlarge it. So as you can see, we're in a pretty steady incline now. And this is not due to China. This is due to outbreaks in the rest of the world. So this is alarming, and people really need to start getting things under control. And that's all we have for today. Thank you.